We may only be a few weeks into winter, but this year's respiratory virus season is already in full swing, with COVID-19 and flu cases surging across the country.
Yeah, the state health department is also reporting an increase in hospitalizations for both illnesses, along with a rise in RSV cases as well. The increase means that some businesses and organizations are making a lot of changes to keep everyone safe and to keep everyone healthy.
Well, Channel 2's Claudine Ewing tells us which local church is putting part of the sacrament on hold.
No Holy Communion wine cups if you attend Catholic parishes in the Tonawandas.
St. Christopher's in Tonawanda, St. Amelia's in Tonawanda, St. Francis in the city of Tonawanda, and then St. Jude the Apostle and Our Lady of Czestochowa.
It's to limit exposure to RSV, COVID, and the flu.
We don't have, statistical numbers of who's sick, but you can definitely notice more and more at Mass, especially this time of year, people sneezing, coughing. A couple of our deacons over the last couple of weeks have gotten quite sick.
Health experts say many of the viruses are spread through contact or droplets.
If you're going to areas where there's a lot of people gathering, those high-touch surfaces like doorknobs and other areas in churches, pews, and other things where everybody in there would be touching, it would be advisable not to touch them or wash your hands very frequently.
Oshai Children's Hospital President Dr. Stephen Turkovich has some good news.
We're starting to see some decreases in both the flu and RSV, and actually also COVID.
But it's not over. He says last week there were 112 children admitted to the hospital with respiratory illnesses, 14 for the flu, over 70 for RSV. People can be vaccinated for RSV, the flu, and COVID. But this is something to keep in mind. Doctors say there is a new variant that seems highly transmissible.
And those home tests that we were relying on a lot still work. However, they don't seem to be testing positive when you have COVID until the third or fourth day of illness. So if you're starting to get some sniffles, maybe a sore throat, headache, and kind of feeling fatigued, thinking it's COVID, and you test yourself and you've had symptoms for only a day or two, and it's negative, I wouldn't say for sure that you're negative.
On your side, Claudine Ewing, Channel 2 News.